Many of us are feeling worried and anxious with the threat of COVID-19. We need to remember to always take the time and invest in ourselves. Good personal hygiene is a very basic but effective way to feel good about ourselves while taking the necessary steps to maintain our health. In today's program, we explain why we need to practice good personal hygiene and best practices that promote good grooming. I'm Dr. Freddy Gomez. You're watching Med Talk Health Talk. Good personal hygiene is one of the most basic ways to ensure good health. It's also our best line of defense against the COVID-19 pandemic. Today, our guests bring you a guide to personal hygiene. I'd like to welcome you on the show, the President of the Philippine Dermatological Society, Dr. Peachy Paz Lao. She is the OIC of the Makati Medical Center's Aesthetic Center and head of the laser section. We also have internal medicine specialist, Dr. Adrian Paul Rabe. He's the Managing Director and Epidemiologist of Global Health Focus. Welcome to the show, doctors.
Hi, hello.
Thank you
hello,
for having
everyone.
us.
Now, I'll start first with Dr. Rabe. What is personal hygiene and why do we need to practice this?
Personal hygiene means many different things across the globe. But in general, we're talking about cleanliness of the body. And when we talk about dental hygiene as well, we're talking about cleaning the teeth and skin hygiene as well. We also have something called sleep hygiene, where we should allocate some good amount of time for our sleep as well. So overall, hygiene is about overall body health as well.
Okay, and we know that good personal hygiene lowers the risk for diseases and illnesses. Unang na-expose sa viruses at bacteria ay ang ating balat. And in order to avoid the spread of these harmful substances, personal hygiene is a definite must. Now, Dr. Lau, many are very conscious now about washing their hands, which is good. But could there be something about washing one's hands frequently that the viewers should be aware of?
Well, washing the hands is really one of the ways wherein you can keep yourself healthy, especially now during COVID. But overwashing can be a problem, particularly for those who are frontliners who actually really have to wash in between seeing patients. You can have very, very dry skin because of frequent washing, particularly if you use harsh soaps. So it's like an irritant contact dermatitis and very dry skin. So that's what can really happen. And it's actually happening now.
Okay, and there are many types of personal hygiene aside from washing your hands properly. Can you briefly explain other aspects of personal hygiene, Dr. Rabe?
So overall, we're talking about bathing regularly. We also have, and I'm sure Dr. Lau can give more insight on this, making sure that we wash every single part of our body. Dental hygiene is also equally important. Patients who have poor dental hygiene are known to have a correlation with heart disease also. And finally, as I mentioned earlier, sleep hygiene, wherein we also have good amounts of sleep and good restful sleep is also important.
And good body hygiene helps prevent skin infections. Dr. Lau, explain natin, how does poor hygiene cause these skin infections?
If you don't take a bath every day, that's number one. Maligo dapat araw-araw. We should take a shower at least once or twice a day. If you don't, you keep your bacteria in the skin. You keep your sweat. The presence of bacteria and the presence of sweat will actually be the initial causes of skin diseases. That's why you have to really take care of your hair, your body, your nails every day.
And we'll talk more about hygiene-related diseases when we come back. You're watching Med Talk Health Talk. Stay with us. Welcome back to Med Talk Health Talk. Today, we're talking about personal hygiene. Poor hygiene can make the human body vulnerable, leaving disease-causing germs to grow. And because of this, there are several conditions that could develop over time. Now, Doc Adrian, what are some of the different hygiene-related diseases we need or our viewers need to be aware of?
So it's very important to note that our body is always under attack from everything in the environment. So we're talking about bacteria, fungi, sometimes even insects like body lice. The world's leading cause of blindness, which is called trachomatis, is actually caused by poor hygiene as well. So we even have athlete's foot. We also have body lice, as I said earlier. And as I mentioned, poor dental hygiene can lead to tooth decay. So all of these skin infections and infestations are possible because of poor hygiene.
And as you mentioned, that some of these illnesses do affect the skin. Kanina nabanggit ni Dr. Lau how poor hygiene causes skin infections. Now, let's discuss this further, Dr. Lau. What are some of the more common hygiene-related skin diseases?
Most commonly, particularly during the rainy season, would actually be, as he had mentioned, athlete's foot. If you don't have good personal hygiene, you can also have body odor. You can also have impetigo, and they call it in the vernacular mamaso. You can also have miliaria or prickly heat. We call it bungang araw or prickly heat. These are usually the most common causes when you really don't practice good personal hygiene.
Yes, and Filipinos are more prone to certain skin diseases due to the current rainy season. Minsan hindi maiwasan na makaapak sa tubig baha or mabasa tayo tuwing umuulan. Now, you started earlier, Dr. Lau, how does the rainy season cause these diseases? What are, if we know the causes, we would eventually know the ways in order to prevent them. Could you explain it to our viewers further, Dr. Lau?
Because usually during the rainy season, chances are you'll get your feet wet, particularly sudden floods and all. Then you will get your feet wet. And if you keep your feet wet inside your shoes and you don't remove them to dry up, that's going to be a very fertile ground for tinea pedis or athlete's foot. And also sometimes during rainy season, most of us, they become lazy to take a shower because sometimes they feel cold or things like that. And then you can develop body odor because of the bacteria and the perspiration. They get mixed, particularly in areas like your underarms and the groin. Then you can develop body odor. You can also develop lice, Lisa, in the hair if you don't take a shower every day. And the mamaso, particularly now that we are under quarantine and we know that a lot of our people stay in one place, big families stay in one place, or even in the lower socioeconomic areas, they stay together. And this is a very good fertile ground for bacteria to be spread, especially particularly children who don't take a bath, who play around and spread the disease from all the other playmates they get in contact with.
You are very correct, Dr. Lau. Kaya, Dr. Adrian, napakalaking problema kapag hindi natin nagawang i-maintain ang pagkakaroon ng malinis na katawan. Along with this is the need to keep our surroundings clean, as this can affect our health as well. Now, how can we prevent sicknesses from happening lalo ngayon na may pandemic, Doc Adrian?
So one of the more common advice that you will see everywhere, kailangan mag-suot ng mask. Adding on a face shield is also important. But like you said, environmental hygiene is very important. Keeping your surroundings clean, and especially in the rainy season, making sure na wala tayong stagnant water, because other disease apart from skin disease can develop because of poor environmental hygiene. If you've heard of dengue, malaria, the rainy season will bring all of these conditions in terms of a higher level. We also have leptospirosis as well. Kaya environmental hygiene, apart from body hygiene, is also important.
And ahead on the program, we'll talk about what a good hygiene routine actually looks like. You're watching Med Talk Health Talk on CNN Philippines. We've talked about why good personal hygiene is important, and we've also touched on the conditions that are prevalent in those that don't practice this. But what does good personal hygiene involve? Welcome back to Med Talk Health Talk. Now, let's discuss ways in which we can practice good personal hygiene to minimize not just the risk of COVID-19, but to safeguard our overall health. Now, Doc Adrian, what are healthy habits of personal hygiene?
So we could start with ourselves, no? As mentioned earlier, we take baths regularly. When we say a bath, kailangan thorough from head to toe. But apart from this, kailangan isama din natin ang paglinis ng bahay at ang surroundings natin to make sure na all these sources of bacteria, germs, insects, and other potential problems ay ma-address natin.
And still with Doc Adrian, kung lalabas ang isang tao sa bahay nila, anong dapat na nasa, let's say if they had a hygiene kit, ano dapat ang laman ng hygiene kit nila?
That's a very good question. Especially ngayong panahon ng COVID-19, we have to make sure meron tayong hand sanitizer in our kit. And among those na talagang very often na nag-hand sanitize, sometimes moisturizer is also important. Like a lotion, for example, for the skin. We also have to make sure na well-hydrated yung skin natin. So, for example, a lip balm to make sure your lips are not cracked. And all of these other measures, especially a mask, of course, when you're going out.
And I would ask this same question to Dr. Lau. If someone would have a personal hygiene kit that would be skin-specific, what would it entail? What would that hygiene kit look like, Doctora?
I think it's usually just for now, if you go out, you should have a tissue paper so that you can wipe your perspiration. You can have a hand sanitizer or even an alcohol spray. And you can have your usual small bottles with lotions so that after washing the hands, they can put lotion after washing their hands so that the skin doesn't dry up very well. That would be just maybe for a simple kit when you go out. But what's more important also is, like right now, we're mostly inside our homes. What should you do inside your house? How do you stay healthy?
Okay, very good advice. And bad personal hygiene can be indicative of other diseases, including primary focal hyperhidrosis or abnormally excessive sweating. Now, Dr. Lau, what causes this hyperhidrosis?
Hyperhidrosis, sometimes you have to make sure, number one, that you don't have any endocrinological problem that can cause hyperhidrosis. Usually, it's just really hyperactive glands. Your parasympathetic system is really very hyperactive. That's why there is really you cannot really say a permanent cure unless it's triggered by an endocrine problem, like let's say hyperthyroidism. If you treat it, then you treat your hyperhidrosis. Most of the time, we call it idiopathic from overactivity of the parasympathetic system. There are a lot of things which you can treat your hyperhidrosis with. It can start with, number one, personal hygiene. Number two, there are some lotions which can minimize and dry up your perspiration. And number three, the one that offers a little bit of a temporary permanency for several months would be your botulinum toxin A.
Okay, and still along the lines of hyperhidrosis, Dr. Lau, there's also a condition na tinatawag na bromhidrosis. Could you talk more about this? Because I believe this is the main reason why people have body odors.
Yes. Bromhidrosis is body odor. Okay, so this happens when the sweat would actually block our sweat glands. They cannot come out anymore. They block. The sweat stays on the skin, and so we usually have resident bacteria. And when that happens, the balance in our body doesn't is taken out. The normal balance is not there, and so the bacteria overpowers everything, and so you get your body odor. So that's why it's very important that you keep your skin healthy. When you perspire, when you exercise, you have to change your clothes because whenever you change the pH and the atmosphere of your body, bacteria takes over, which produces the odor that is not really very acceptable. You usually should ask, how often do you take a shower? Because some really don't take a shower every day. So that's number one. Number two, advise them to change clothings. Like when they walk around, when they perspire, and then to change the clothings. And number three, there are some topical medications which we usually give, which can address body odor. But it's really more of an interplay of making sure internally there is nothing wrong with the patient. You have to do a little examination, and then outward externally, we have some topical medications to address that. And again, good personal hygiene.
Yes, we can't stress that enough. Now, Doc Adrian, do you have any tips for our viewers on how to maintain their good personal hygiene?
Well, it's very important to start from head to toe para mas madaling maalala. So, of course, start with your shampooing, clean your face, make sure every single corner of your body is clean until you reach your toes. But apart from your body, like I mentioned earlier, you have to also focus on your surroundings. Malinis ba ang bahay? Ang mga stagnant water ba ay natanggal, especially during the rainy season? Because all of these other factors can affect your health. Kaya head to toe, and also look all around you in your surroundings, especially at home, to make sure you have hygiene at home as well.
Now, maintaining personal hygiene is part of our daily routine that we often think very little about. But it's key in keeping ourselves and those around us healthy. So, wash your hands thoroughly and do it often. We'd like to thank dermatologist Dr. Peachy Paz Lau and internal medicine specialist Dr. Adrian Paul Rabe for sharing your time and expertise today. I'm Dr. Freddy Gomez, and we'll see you again next time right here on Med Talk Health Talk. You're watching CNN Philippines.